elements that are actually found when a person has the celiac disease. If you don't have them, it's highly unlikely that you have celiac disease. But the last thing that will prove that you do not have it will be an endoscope. Treatment. Gluten-free diet is the very best treatment because there is no medication for having CD. When you have gluten-free diet, things that you need to avoid is wheat or wheat flour or wheat rice. Anything that has wheat. You also cannot eat dryly, barely. You can't eat gram flour, you can't eat cinnamon, you can't eat malt, you can't eat jam, you can't eat fromen. Etiology and epidemiology. The aim of this is actually a research conducted in South Africa with patients with diabetes type 1. What we wanted to see was actually that do patients with type 1 diabetes also have present symptoms of the celiac disease? And what we found out was that there are patients with that. However, the method and the methodology that was used in conducting this research is that we had to do a cross-sectional observational study. Then we had to screen about 202 patients. Of these patients, we have 56.4 that were black, 31.7 that were Asian Asian Indian, 4.2 that were white, and 7.4 that were mixed race. The demographic data and symptoms actually portrayed in the blood test as well as the anti-tissue TG. What was there in the EM is that the diagnoses were based on a modified MASH classification. In conclusion, from the results obtained in South Africa is that prevalence of CD was very similar in the reports to the Western countries, whereby no specific ethnic group were noted. CD was a silent disease in patients. Sensitivity came with the EMA, and the triglyceride antibodies was poor on merits of further evaluation and screening for the South African patients with type 1 diabetes. These are the stats of the Western countries. The pathogenesis. So here what happens basically is that we have dietary gluten. What it happens is that it gets absorbed within the body system into the intestinal lamina. And then it goes down. When it goes down, it travels. When it travels, the gluten peptide react with the triglyceride in the subepidermal lamina. When they react, a bit of fusion occurs and a bit of killing. This is survival of the fetus. Then this is the serial component stimulated by innate immunity in the epithelium and the dendritic cells. This comes in. So when it travels down, it comes. Then the gluten peptide gets cross-linked, and then it is present in the T cells, in the APCs, and then when it comes here, then it goes to the CD4 cells. From the CD4 cells, it actually now branches out. It either branches to the matrix, where it's going to be degraded, to the mucosal remodeling, or it can come here to the B cells. From the CD4 cells with plus the T cells, it will become to the beta cells. Then we have antibodies, gluten and triglycerides. Then we also have here the autoantibodies that are bound to the tissue or released in the blood. When it travels in the blood, this is what it's going to get. It becomes a disease because it's now in the bloodstream. Disease progression. It's got 4 stages. First, we need to check the increased percentage of interepithelial lymphocytes, it's lymphocytes. Stage 2, we have characteristics by the increased presence of inflammatory cells as well as cryptic cells with preserved various architecture. Step 3 or stage 3, it will be the mild, moderate, and subtotal various atrophy. Lastly, we will have the total mucosal hypoplasia. Clinical manifestations. Clinical manifestations that Mr. X had was that Mr. X did deny any risky behaviors. Common symptoms, he did not have any of the common symptoms. This is because the celiac disease for Mr. X, it was hereditary due to that he had a family member that had Down syndrome and was also present with the celiac disease. Most adults do not actually note this disease as because they get to have different type of diseases as aging comes to play. You can have osteoporosis as a disease and you will not even think that you could possibly have CD. The discussion. After the case was reviewed and after the different cases of the patients after Mr. X, clinical different situation explain the development of hemorrhagic events such as acoglopathy due to vitamin K malabsorption, celiac crisis, and portal hypertension or digestive tumors, malabsorption of fat, insoluble vitamin A, D, A, E, and K, is encountered in the bowel syndrome. CD as well as low levels of vitamin A and E and K were also found due to the intestinal absorption impairment. Vitamin K, which is very important in hepatic synthesis to do with the liver, both were actually affected by this. Therefore, the hemorrhagic events that happened here is that the pathogenetic of this caused a lot of fluid to actually not be absorbed, making it hydroelectric disturbances because there was not a lot of people were getting food. And then what you need to actually understand in summary of this is that after different administration of vitamin K were recommended, not a lot of patients were actually able to actually come back because there is no cure for this or there is no medication to be actually used. So in conclusion, the celiac disease testing should be considered on all patients with idiopathic hemorrhage, diathesis, concomitant troubles, and low levels of vitamin K, known or unknown. Regardless of anything, CD is a very, very clinical disease that you should actually take note of, especially when you have any problem with your digestive system and you're actually not sure of what the problem could be. Awareness is also very important. The video link I will definitely attach it after this video. Thank you.